According to the Ontario Nurses Association, since 2018, there have been hundreds of cases where patients' care at the Brantford General Hospital was at risk or delayed because of staffing levels. Those issues were discussed at an independent hearing this week.
What we're seeing is that this department, like many others in Ontario, but this one in particular, is chronically understaffed. There's a revolving door of staff in there related to, lack of leadership in this department in particular.
The Ontario Nurses Association says that the emergency department of the Brantford General Hospital is such a mess, patients and staff are suffering. The president of the ONA says that since 2018, the ER nurses at the Brantford General have identified over 300 cases where patient care was at risk or there were delays in care.
What we're seeing as far as how it impacts patients is patients are taking longer time to even see the triage nurse. Ambulances are waiting longer to be checked in and given a bed. We're seeing an increase in mental health patients and the acuity of those patients.
The staffing levels in patient care were topics of discussion at an independent hearing this past week. Hospital management, along with the impacted ER nurses and the Ontario Nurses Association, met with a panel of 3 experts.
This independent assessment committee will make recommendations, and this hospital will have the option to implement these recommendations made by this expert panel.
But then it will be up to the hospital to implement the recommendations.
Technically, they're not binding legally. However, it would be against anyone's best interest, I would feel, that if an expert panel anywhere in any sector of healthcare or otherwise made recommendations and you failed to acknowledge them and implement them, I don't think that would be in the best interest of patients or the community.
The findings should be out within 45 days. We reached out to the Brantford General Hospital this weekend for comment, but didn't hear back.